Thanks for joining 1upHealth in Boston today. This city was created by people with an unshakable belief that they could build something better. And today, Boston has become the nexus for life sciences and digital health companies from around the world. So it's not a surprise to see that 1upHealth got its start here, with a mission to transform people's lives and help the healthcare industry interoperate better. Up until recently, healthcare interoperability is slow, with vendor lock-in killing innovation before it even started. And this led to terrible outcomes. Patients weren't able to get access to their data, providers had to deal with technology that was worse than social media apps, and the rising costs of healthcare in the United States was a huge problem. Today, the United States spends 5 times more in healthcare costs than any other developed nation. And we don't even have better life expectancy to show for it. We felt things had to change, and there was a spark of hope. A confluence of factors came together. First, there was a transition towards value-based care, which benefited from data outside your walls. This meant that you could improve readmissions, you could reduce costs or other unnecessary care. Second, there is the entire technology industry that are creating new modes of compute with the cloud, new standards like RESTful APIs and OAuth 2. And those all had direct applicability to the healthcare industry. And third, policies creating a bridge between data that was needed by organizations and the means to present it. Government regulations like Meaningful Use 3 and the Cures Act created requirements for new standard APIs. And this new standard was FHIR. When FHIR came out, people were skeptical, especially the legacy health vendors. They thought that their own proprietary data models were better, or that FHIR wasn't going to scale and that it was only meant for one patient at a time. Maybe they didn't think FHIR would ever catch on. We knew that FHIR alone wouldn't be a panacea. An intelligent data platform in healthcare must be centered upon FHIR, but it needed more. The ability to connect, clean, and compute on this data would truly unlock the potential for the healthcare industry. So we built far more than a FHIR server. 1upHealth created a scalable serverless infrastructure in the cloud that was wrapped up in an effortless managed service. We incorporated the highest levels of security with granular access controls so that you could manage users and data rights on individual resources. We added immense detail to the cleansing, ingest, and standardization of this data. And finally, a connected network of apps, payers, and providers to work together. To support any app with any use case, we needed the ability to interact with data one patient at a time and at a population level. Because of this, we have seen a tremendous amount of interest from the most innovative companies in healthcare. Today, 1upHealth is operating the FHIR infrastructure for 40 health plans, and more health plans are live with CMS patient access requirements using 1up's technology than all the other vendors combined. Hundreds of application developers, including organizations that are 2 people in a garage, all the way to enterprise businesses with hundreds of thousands of employees, are using 1up to connect to the industry. They're using it to build on data from thousands of providers and payers across the United States. More than 30 million patients have their data in 1upHealth's infrastructure, and we want to help the entire community unlock the value for them. These records have generated over 5 billion FHIR resources. 1upHealth has hands down the most comprehensive and technologically advanced FHIR infrastructure. And today, we're sharing how we're going to make it even better. We're announcing broad updates to our core FHIR platform, new versions of our 1up Connect infrastructure, and a whole new analytics on FHIR. The teams at 1upHealth have been extremely hard at work building this from the ground up, with standards at the core so that you can think about this beyond compliance, about what really matters, improving patient lives. So I'd like to invite Judy Chong, our VP of Marketing, to share a story from a patient's perspective.
Healthcare interoperability is a busy space, but amidst all the noise, we wanted to bring it back to why 1upHealth was started to begin with. Ultimately, it's about transforming how healthcare operates and provides value for the patient. In today's world, the lack of data interoperability is not only frustrating, it also impacts wellness, the delivery of care, and access to life-saving treatments. You're about to hear a patient story as told by Eliza Perry.
My husband and I had been married for about 8 months, and we were getting ready to go to a concert. I happened to be very pregnant at the time too, and I heard from the bathroom my husband saying that he thought the house was struck by lightning. And at first I was a little confused, looked out the window, perfectly sunny, I have no idea what's going on, and then he gets more concerned. So Dave's brother drove him across town, and Dave would joke that he experienced the executive birth, which meant he showed up, didn't have to deal with any of the drama. As soon as he was there, they wheeled me right into the operating room, and soon after we had our son James. He ended up going back in for his first of 3 craniotomies on September 11th, 2015. And they diagnosed immediately that he had, at that point, stage 3 anaplastic astrocytoma. Could not believe that it was on us to figure out what the right questions were, to identify the trials that we wanted to be a part of, and on us to collect his medical records that we could then share with Dana-Farber or with Duke for the trial. It was shocking. I mean, we thought we would just be showing up for care, but we had to do a lot of legwork behind the scenes. We were tenacious. I mean, we were initially told that it would take a week, maybe longer, maybe a couple weeks to get the records, and that was not an okay answer for my husband. I mean, when you're given a prognosis of months, everything matters, every minute matters. So Dave and I, and at the time James was an infant, maybe a month or 2 old, we would just sit in the record center in the basement of MGH and just sit there. So they knew who we were, and you know, it worked. So we'd get our scans, submitted it. But again, with the medical records, we had to go back to the basement. We sat there, my son, Dave, and me, and again, we're able to get it, but it took us driving the process. He was not okay with just sitting at home and waiting for an email or waiting for something in the mail. He was gonna be there, and he demanded his records. It was shocking. I mean, everything right now is connected, everything. And it's digitized too. I mean, it's in the computer system, right? It's in Mass General's system. It's in Patient Gateway. It's there. So why does it take us going to request a physical CD to then snail mail to North Carolina? I mean, that was probably the more frustrating things, because I mean, that could have happened in a matter of seconds if everything was connected. Think about the patient's experience. I know there's a lot of sensitivity around patient privacy, and I understand why that needs to be, but the onus should not be on the patient to be driving and connecting all of these dots. Everything is time sensitive. I mean, every minute counts when you're dealing with an illness that is not curable. I mean, you want to be spending your time with your family instead of stressing and trying to figure out logistics around how to manage your own care. I would just say go back to the patient experience. Think about them first.
Millions of patients and caregivers are all too familiar with Eliza's story. That is why we are all in this together, to ensure that access to data is easy and instantaneous. To talk more about our FHIR platform, I'd like to introduce you to Kyle Brew.
Thanks, Judy. Today I'm excited to share a few updates about our FHIR platform. 1upHealth is purpose-built on FHIR. Our platform stores data natively as FHIR in several data stores, each optimized for specific access patterns, such as FHIR APIs, FHIR bulk data, and SQL. Our APIs are built on the latest serverless cloud technology, which scale on demand, whether it's to retrieve a single patient encounter or a complex query across billions of resources. In 2019, 1UP led the balloting for the FHIR bulk data standard, paving the way for population use cases on FHIR, such as risk stratification and care management. Our FHIR bulk data APIs allow for a full system export, with the ability to segment by resource type and timestamp. But before you can use these APIs, you first have to load the data as FHIR. The 1upHealth FHIR platform makes it easy to get data into FHIR, regardless of the original format. Our data mapping tool, DEMA, allows non-technical users to efficiently map data to FHIR. Users can define and apply mappings to sample data to immediately see results and iterate. Mappings are versioned and can be simultaneously collaborated on. These mappings integrate directly with our ingestion pipelines. Our cloud ETL tools scale automatically and can ingest hundreds of thousands of FHIR resources per minute, a 20-factor increase in the past year alone. Our pipelines track data lineage, provenance, and log errors for full traceability. This means you don't have to second guess where data came from or if it's a duplicate. We know FHIR is the future, and with 1upHealth's industry-leading data ingestion tool, we are making it easier than ever to be a FHIR-first organization. Besides data ingestion, we spent most of the past year focused on maximizing the performance and security of our platform. In this coming year, we want to make it as easy to use as possible. That is why we're building a suite of user interfaces we are calling the 1UP console. This will serve as the front door to our FHIR platform. Our first console app is our reporting dashboards, summarizing key details: how many resources are loaded, what is the API usage, how many members have authorized data sharing. And we're not stopping there. In short order, we'll be launching new apps, such as the FHIR data browser, so you can visualize FHIR resources without an API tool, third-party app management, so you can view and revoke which apps have access to your data, and an app to manage provider EMR integrations, including member rosters and ingestion frequency. Fueled by legislation and an overall shift to APIs, the adoption of FHIR in healthcare continues to grow rapidly. At 1upHealth, we're thrilled to be building the future of healthcare on our FHIR platform, and we're only getting started. I'm now going to go deeper into how our platform specifically addresses health plan use cases. The federal government issued a vast set of interoperability rules in 2020. The goal was to help prevent info blocking and to empower patients to access their health information. This was groundbreaking, and it of course had an enormous impact on insurers who offered government plans. First, CMS introduced the patient access rule that enabled patients to share their records with apps via FHIR. Then payer-to-payer, which required health plans to share information with each other. We at 1UP jumped at the opportunity to apply our FHIR platform and expertise to create a market-leading solution for payers. Our payer platform consists of our FHIR server, authorization server, our member auth app, a developer console, and a third-party app gallery. Our member auth app provides several ways for members to authenticate before authorizing their data to be shared with third-party apps. First, we offer an email-based consent process, where members provide demographics, their member ID, and a verified email. We also can integrate directly with identity providers so members can use their existing login credentials. Once a member or their personal representative has been authenticated, they're presented with information and options on what specifically will be shared. For example, members can choose to opt into sharing sensitive data, such as mental health information. We've been working closely with app developers since our beginning, and we know firsthand how frustrating and lengthy the process to develop and get healthcare apps approved can be. At 1upHealth, we strive to make a transparent, straightforward process for developers to register, test in our sandbox with synthetic payer data, and obtain approval to access our 40+ payer endpoints. While the industry is still in the early days of capitalizing on this newly available payer data, we're seeing momentum with early apps, including OneRecord, My Family Health Record, and MaxMD. We foresee the number of apps increasing significantly in 2022, spanning personal health records, financial assistance, clinical trial recruitment, and wearable device apps. With our 1UP payer platform, you can rest assured you'll be fully compliant with the CMS rules. But checking the box is just the beginning. What really excites us is the integration of claims and clinical data in a common FHIR format to radically improve healthcare. I'll now hand it over to Christina Botenko, our head of product for patient-facing applications, to present our request and ingest product.
Individuals have access to their health information like never before. Both providers and payers are being mandated to allow for the sharing of data via FHIR with any third-party app of their choice. With Request and Ingest, customers can leverage the 1UP network of patient-mediated endpoints to request previous health information and ingest that information into a clean, uniform FHIR dataset. This app can be used for CMS payer-to-payer mandate, which requires individuals to bring their health data with them from their previous plans. Health History is our front-end UI that enables the patient to search and authorize access to their medical information, landing the data in the customer's 1upHealth FHIR platform. With access to rich, structured FHIR data, 1upHealth customers can continue to focus on improving patient outcomes. With the patient app, individuals can leverage the 1upHealth network of patient-mediated endpoints to access previously unobtainable clinical and health information. Our patient app allows for the access and aggregation of this data like never before. It's your data unlocked. You own it, and now you can control it. As individuals move between providers and payers, they have the ability to maintain a longitudinal electronic health record over the course of time. With all of the data in one place, individuals are better positioned to control their healthcare destiny. And to talk about clinical connectivity next, we have Katie Dean.
Thanks, Christina. As the government has introduced info blocking rules, API-based access to EMRs has made vast amounts of population-level FHIR data available to organizations with appropriate data use rights. With clinical connectivity from 1upHealth, we can give you access to these rich data sets through adapters to major EMRs such as Epic, Cerner, and Athena. After providing 1upHealth a roster of individuals indicating recurring or HL7 event-based timing, the data collection process will begin. It's as simple as that. When you add clinical FHIR data to the mix, there are many paths to improved outcomes. You can pipe it to your downstream systems via SQL on FHIR, or generate insights on the platform with 1UP's broader analytics suite. The sky's the limit. And now, from the product team to tell us more about that, Kevin Yamashita.
Here at 1upHealth, data is at the center of everything we do. Analytics are core to our ethos as a company, but there are very few tools today available to interact with FHIR data at scale. So we're here to help. 1UP SQL on FHIR product enables you to get more ROI from your investment in our FHIR platform using the tools your team already knows, like SQL, Tableau, Power BI. And with these tools, you can query FHIR data at the population level. With SQL on FHIR, you can get answers to complex questions, gaining insights into your data and making better decisions. All the data in your FHIR server is accessible in near real time with standard SQL or BI tools already in place at your organization. This read-only access to your data is protected with the best multi-layered security and encryption features the cloud has to offer. You'll receive extensive usage guides, quick start materials, and dashboards to get you started quickly. Recently, one customer of SQL on FHIR said, "Never take this away from us." We know you'll love it too. We're not solely in the business of laying pipes here at 1upHealth. We also want to create opportunities for our customers to innovate on their data directly within the platform. 1upHealth's analytics framework applies the power of modern analytics tooling, including machine learning, directly to your FHIR data. It's easy to get started discovering insights and creating compelling visuals on your data with native support for industry standard tools like Python, Jupyter Notebooks, and R. Our framework makes it easy to apply cutting-edge machine learning tooling to your rich FHIR datasets. And once you have those analytics tuned just right in the sandbox, you can containerize and deploy those apps with ease. With 1UP's analytics framework, we provide all the infrastructure you need to quickly find value from your FHIR data, uncovering insights and intelligence you didn't even know existed. And we're just getting started. Tune in next time for more on all the first-party analytics apps that are just around the corner. But for now, it's time to say goodbye. So with that, I'll send it back to Ricky to wrap us up.
Thank you, Kevin, and thank you to all of our presenters today. We've had an extraordinary set of announcements. The 1upHealth admin panel and data mapping tools for our core platform are unrivaled in the industry. The 1UP Connect network supports payer connections across the United States and is the first and only tool to do so to help you meet the payer-to-payer requirements. And finally, the SQL on FHIR analytics tools bring the industry standards closer to tools near you. Out here at 1upHealth, we want to continue to push the boundaries in healthcare. Thank you for joining us today.